Identify the patient as per policy, asking them to state their first name, surname and date of birth. Check that these details and hospital number match those on the request form and wristband. Check indications and contraindications for the procedure and if the patient has any allergies. Introduce yourself to the patient, explain the procedure to the patient and gain consent to proceed.
Okay, this is a demonstration of a diagnostic pleural aspiration. The patient's got a unilateral pleural effusion which needs to be investigated. I've already taken consent. I've marked the skin following an ultrasound scan and the patient's in the right position for me to start. First of all, what I'm going to do is just to clean the skin with some pleural prep sponges in a circular motion. Nice wide area around where you've marked. I'm going to do the same again. Clean the skin in a really circular motion, a nice big round area. And I'm going to place a sterile drape on the skin of the patient. Give yourself a sterile area and keep the patient nice and clean. Just go over the top of the skin, and you can just fold that up at the back here. So again, you've got this nice big sterile field. This is diagnostic pleural aspiration. I don't need to give the patient any local anaesthetic because essentially the collection is big enough for me to get easily. The patient's comfortable, they're not anxious about the procedure, so I can just go in and out with a green needle and syringe. It's a very safe technique. Your 50ml, 60ml Luolox syringe here, you can just see at the bottom here, that will just screw onto the end of the needle. And just give that syringe a bit of a prime because it does get a bit stiff when you're trying to take the fluid out. Just slides the sides down there. Put the syringe onto the end of the needle, and if you keep your numbers uppermost, you can see how much fluid you're aspirating. If I just get a piece of gauze here, I'm going to take the cap off the syringe, and then I'm going to proceed. The skin is clean and prepped, so I'm just going to have a little feel over that area to make sure I'm going over the top of the rib to avoid the neurovascular bundle. And I'm going to anchor my hand against the skin. I'm just going to pop that needle through, sharp scratch, and as I go through, I'm just going to be aspirating for fluid. And as soon as I get through into the pleural cavity, my fluid will come out, and I just need to fill that up between 50 and 60 mils. You can see at this point I'm not pushing my needle any further in because I'm getting the fluid at this point, and that reduces the risk of complications. Once you've got your fluid here, just get some folded gauze over, straight over to the edge, bring your needle out and just put your needle and syringe onto your sterile tray. And at this point you can just make sure your patient's nice and comfortable and pop a dressing on. Okay, Okay, so if we wanted to take more than 50 or 60 mils off, say the patient had a larger collection and was symptomatic, breathless, cough, uncomfortable, then you could use a diagnostic therapeutic approach. And what we're going to do is just show you how to do that. So if you're going to take more than 60 mils of fluid off, then I suggest you give your patient local anaesthetic. So I've drawn up 20 mils of 1% lidocaine here. And what I'm going to do is just give that into the 4 quadrants over the area that I've marked. Sharp scratch, aspirating and infiltrating as I go through. Just place some gauze over the top of that. And then I'm going to use a different size needle for deeper infiltration. Again, I'm going to use the same puncture point that I went to before, and I'm going to anchor my hand against the skin here to make sure I get straight into the pleural cavity. Anything sharp? No? Okay. So I'm going to aspirate and infiltrate as I go through into the pleural cavity. Aiming towards the opposite shoulder tip. And as soon as I get my fluid back, so I'm just going to remember the depth and the angle that I've gone in to get into the pleural cavity. I'm just going to give us the last amount of local anaesthetic into pleurally, and then what I'm going to do is I'm just going to come out and cover that over with some sterile gauze. So at this point, while the local's working, I'm just going to prepare my kit. So these are the pleural aspiration kits that we use in the trust. There are different types of aspiration kits. I'll just demonstrate this one. So you'll find some needles in the kit here, and I wouldn't suggest that you use these because they're quite large and can cause quite a few problems. What we actually do is use a large bore cannula, a grey or an orange cannula, which makes it a lot safer. Prepare the bag ready. So you need to make sure that you have checked the connections here, that they're tight and there's not going to be any leakage. Then if you take the red bung off and pop your syringe onto the end of that ready, should you need to aspirate. Then there's a Luer lock cap on the end of the bag here. If you just take that off ready, and what will happen is that will go onto the end of the cannula. Open out your bag ready, because it's quite difficult to do all of this when you're holding on to the pleural aspiration kit and the cannula. That's all ready to go. Now you don't need to put a syringe onto the end of this, but if you cannulate the pleura, you don't get a flashback of blood like you might if you were cannulating a vein. So if you take the 2 ends of the cannula off and you just put your syringe onto the end of that, and that's ready to go straight in at the same depth and the angle that you went in to get your pleural fluid. So just take the cap off carefully, and then you're ready to go in to the patient's thorax. Okay, so again you're going to remember the depth and the angle that you went into. Going to be aiming towards the opposite shoulder tip over the top of the rib to avoid the neurovascular bundle. And as you're going through into the pleural cavity, you're aspirating and infiltrating to make sure you know exactly where you are. Just edge yourself in there. And I know that I'm going to get fluid at about 2 to 3 centimetres. Start to see the fluid coming back. At this point, get a good glug of fluid. And what you're going to do at this point is you're actually going to remove the needle of the cannula and push the whole cannula in. Pop your thumb over the edge, and then you're going to attach the end of the therapeutic kit to the end of the cannula. And at this point you should see some fluid coming down into the tubing. And again, if you don't get that, then what you can do is you can ask the patient to cough, and that increases the pressure in the interthoracic cavity, and that'll just help with flow. If you needed to aspirate a fresh sample, you could use your needle and syringe here. So you can see the three-way tap is open to the syringe, it's open to the patient, and it's open to the bag. So I need to turn that round so that it's closed to the bag and open to the patient. And at this point, I'm just going to aspirate 50 or 60 ml of fluid into there. You can then close that over and again get your patient to cough, and then the rest of the fluid will drain into this bag. If you want to use a gravitational effect, you can use the sterile pack from the dressing that you've opened, and you can let that just lay on a low table on a sterile field, and then that fluid will just drain out over about 5 to 20 minutes depending on the position that you've put your tubing on, the patient, and how much fluid there is in there. What I would suggest is, for a therapeutic effect, you take about 500 ml of fluid. If you've got somebody with a very large effusion, you can take up to 1 litre or 1.5 litres. Once you've taken that fluid off, what you then do is take some folded gauze, pop that over the top here, and just remove your cannula, and it's very, very safe there. You can then get a dressing over the top, and you've left your patient comfortable. And at that point you can go and deal with your pleural fluid and take some samples.